Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Hello, everybody. This is Dr. Jeff Haddad. Unfortunately for us, Dr. Joe is not with us tonight, but fortunately for him, he is on vacation. He's down in D.C. with his children, and he is letting me, I guess, handle the show tonight. And so I have a special guest tonight. Actually, I brought one of my team members tonight, Katie, one of our hygienists. Welcome, Katie.
Thanks for having me.
It is going to be a great show tonight. I'm really excited. I'm disappointed that Dr. Joe is not here, but he's going to love listening to this show. He may even be listening right now. But Katie, I'll tell you, I was thinking about what we could do tonight different, and our listeners, we just have such great listeners, and we've covered a lot of great topics in the past. But I think that the main thing that people want to hear is really how different dentistry is today. You know, I think a lot of people are fearful of the dentist. They haven't been there in a while. Maybe they're afraid of, being judged, or maybe their dental situation being worse than they want to deal with at this time. And I think the goal for tonight is really to show them not only is it not too late, but we will welcome you. Okay, we have seen a lot worse than you can imagine, and really it's never too late. And so why don't we do this? Obviously Dr. Joe, every one of his shows he starts with a scripture. I want to keep along those lines, keep the integrity of the show. I found a really good one from Isaiah here. The Lord will guide you continually, watering your life when you are dry and keeping you healthy too. You will be like a well-watered garden, like an ever-flowing spring, which I just thought was a really cool passage. We are all about healthy here, and I think what people want to know, Katie, is, or what we want them to know, and they should know, is really how important their mouth is from their overall health. The connection between the mouth and the body is there. We know this. There's more and more research out there showing the connection to, and the medical community has embraced this a little bit. So in your opinion, you are the person that people see. You're the person that people talk to more than me, okay? For the listeners out there, I know that, your dentist, you feel very strongly about them. But if you think about it, and who you speak with and who you probably have a very close relationship with is probably your hygienist. They're spending more time with you than us. They are the ones who are truly getting you to a level of health that we can build upon. I've used this analogy before. It's like building a beautiful house on swampland. If your gums and the bone around your teeth is unhealthy, you've got a big problem. And that's where Katie comes in. And, I'm just so proud of her to be on my team. And I want, in Katie's own words, what you feel is, I guess, different in overall dentistry. We want to welcome people back. We want to give people understanding that dentistry is not like it used to be. So in your opinion, what are some things that have changed that are going to maybe, I would love to say excite people about getting back to the dentist, but at least, make them understand that things have changed and improved drastically?
I think a lot of things in dentistry have gotten better, thankfully. I think to start with x-rays, digital x-rays. I think on a daily basis, we have patients telling us how much more comfortable the digital x-rays are. The sensor's smaller. For a lot of patients, just even having that cardboard x-ray in their mouth was uncomfortable. So from the very beginning of the appointment, you were already kind of in pain. The digital x-rays are also great because the radiation has been greatly reduced, sometimes up to 90% less radiation.
And people, that's such a big thing for people too, because digital radiography, not only is it better for patients from a health standpoint, but can you even imagine how we diagnosed before?
No.
I mean, I think people need to understand that we're able to blow up an X-ray as big as a monitor, and I mean to see things, the things that we find before they become a problem. I just think it's unbelievable. You wonder how you practiced like that before.
I know. I mean, the other thing with the digital x-rays, too, is we've been able to get all of the chemicals out of our office that were associated with developing the old kind of x-rays, which has been huge.
See, this is why I know Dr. Joe is bummed he's not here, because he would be jumping all over this. I mean, we want to be health conscious, and we don't want all these just artificial anything, and we're going to get to the way we do fluoride, which is another way that things have improved. I mean, anything that we can do to keep people healthy at the lowest risk, whether it be radiation or chemicals or anything. No, I totally agree with you. No, that's a really good point.
Yeah, and I mean, I think it's about keeping people healthy, keeping the environment healthy, any way that we can just do things better.
Look at you.
Yeah.
Saving the world.
Yep.
One cleaning at a time.
One tooth at a time.
I like it.
My husband would say.
I like it. So, all right. So, what are the things are we dealing with that maybe people aren't familiar with if they haven't maybe been to the dentist in a while, or maybe if their dental office isn't as modernized as some others?
I think a big change has even been in the way that we look for cavities. I know before you would go to the dentist, and in order to find a cavity, they were poking around at your tooth. I mean, I remember as a child thinking the dentist was actually trying to create a hole in my tooth.
Of course.
Yes. It turns out they were just looking for a sticky spot.
I've had patients that literally won't let me. They said, don't even think about touching my teeth with that
Oh,
poker
yeah.
thing,
Yep.
Yeah.
So now what we use is called a diagnodent, and it's a laser that actually reads the density of the tooth. So it's more accurate. It lets us be more conservative. But it also lets us put in smaller fillings. It lets us catch things much earlier.
Yeah, it's a measuring tool, and I think what I like about it also is that a lot of times if we're watching a tooth, we always like to watch teeth. We want to be conservative, but I don't want to watch a tooth get worse. I never want to take too much time. And the problem with the older method of the Explorer, it was all subjective. I mean, I touch things. I'm like, all right, yep, it may be a little sticky. We're going to watch it. And then 6 months from now, I'm supposed to remember exactly what that felt like. Mm-hmm. What's cool about this instrument is that it gives us a number. And, let's say that number is a 30. Well, 30 is kind of on the border of whether we would fill it or not. Well, if you come back in 6 months and it's a 45, there's no question that it's progressing. And still, it's very, very small. We can take care of it conservatively. And exactly what you said, we can take away less tooth structure, put a small filling, halt that process, and we're doing it by measured data. I mean, patients appreciate that,
Well, I know there's even been research that's come out to show that with the old way of poking around, so maybe there would be the start of something that could be watchable, but once you poke through it, you can't watch it anymore. You have to fill it.
That's true.
So...
No, that's a very good point. I think the neat thing too is as much as people trust their dentist, obviously I work hard, and as you do, to gain people's trust. And I think all professionals, medical professionals, dental professionals do that. But I think in the back of a lot of patients' heads, they're always wondering, but this is not subjective. It's objective data. I mean, a machine that is amazingly accurate is telling you that you have a cavity. I think we can all feel good about the fact that we need to take care of that, and there's no opinion there. I mean, we can move on and take care of things conservatively. So, no, I'm with you on that.
No, and I mean, I agree. I feel like I do think there's a part of most patients that feels like, I have no idea what you're talking about. Mm-hmm. Sure, you're telling me there's a cavity. I mean, people are always saying that to me. Can I see the cavity on the x-ray? And you're trying to point it out, which with the digital, thankfully, now we can blow it up and show it. But also intraoral cameras, being able to take a picture of the person's mouth and actually show them the problem area. I mean, it's to the point now where patients are helping diagnose their problems and helping to come up with solutions too.
Yeah.
Basically, are you okay with this in your mouth?
Right.
Yeah, I mean, it's not healthy, but you can actually see it. You can see the infected, decayed area where it doesn't seem like... It's for sure. You for sure can see it.
Well, yeah, and I think that people are we have very intelligent people that we're dealing with here. If it doesn't hurt, why would you fix it,
True.
Right? I mean, doc, I don't understand. I have a cavity. Why does it hurt? Well, what people need to understand, unfortunately, when it hurts, it's too late. It's not just a little filling. Most likely, it's it could even be a root canal, which would require not only cleaning out the nerve of the tooth, but then putting a crown on top of it. Much more aggressive treatment. So, common sense would say it doesn't hurt, so let's leave it alone. But again, just like you said, these instruments, these tools, these pieces of technology, they make the patients part of the process. I love it when I don't want to tell people what they need, because unfortunately, you don't need teeth to live. And I know people laugh when I say that, but you really don't. There are a lot of people probably listening right now that don't have teeth, and they're doing fine. But life is better with teeth, okay? Quality of life is better with teeth. And so please allow us to take a look at things and give you our opinion, but again, be part of that process. This is something that it's your body, it's your choice, and when you see the problem with these pieces of technology, it really makes you part of the overall decision. If anybody out there is interested in maybe asking any questions, had any questions for Katie or myself, you can call us at 313-838-1035. And I don't want to forget this either. We've talked a lot about things like this, and people are maybe driving their car, they're trying to listen, half listen. Huge educational opportunity for you is just to take a look at our website. Katie's helped me a ton on our website, and I really appreciate it. We have a lot of education there, a lot of information. It's RochesterAdvancedDentistry.com. There's more information than you probably want to know, but for those of you who are really interested, take the time. You'll enjoy it. All right, so technology. All right, we've covered it, but I think what people want to know, and but that was my goal here, is the actual cleaning. Okay, things have changed. You are a hygienist. That is what you do. You clean teeth. You take care of the gum tissue. You keep the bone that's holding these teeth in healthy. What are you doing? What are we doing in our office that's different than maybe people are used to, and again, better and improved than in the past?
Well, first off, this is my favorite topic.
Oh, and it should be. She's passionate.
I think one of the biggest changes has just been even us teaming up with the medical field. I think for so long there was such a big divide. Where finally it's being accepted that your oral health does affect your overall health. It took a long time for research to catch up with that, and I know you've talked about this on previous shows, but just that it's the bacteria in your mouth, and that same bacteria causes heart disease, strokes, all kinds of different systemic problems. And so I think, just even having that knowledge and being able to educate our patients and keep them healthier overall has been huge.
Well, and I think that patients are more accepting of treatment too, because, again, I love what we do, and again, what we do is very important to us, and it's very important to a lot of people. But I've made the statement earlier, you don't need teeth to live.
And also with you saying that if it doesn't hurt,
right,
why fix it? Gum disease is one of those things.
The silent killer.
Exactly.
Yeah, no, you're absolutely right. And so when when people do hear about the connections between heart disease, stroke, diabetes, I hate to say it's a fear factor, but there's a little fear factor that says, okay, that's a lot more serious than I thought. I need to take care of this. So I appreciate the fact that patients are starting to see the importance of it too. It allows you and myself to do our jobs better. And you never want to push anything on anybody. So when they are more accepting and they see the value, it makes everybody's life a lot easier.
Yeah. Well, even we took that class a few years ago, and I remember the instructor was saying something about if a person brushes their hair and their hair bleeds, they are really concerned.
They're going to freak out.
Yes. If a person flosses their teeth and their gum tissue bleeds, nobody cares.
Yeah, they think that's normal.
It is not normal. It is not normal. There's infection in your mouth if when you're flossing your teeth, your gum tissue is bleeding.
Honestly, that's a great analogy. And that it is. People need to understand that bleeding gums, that is disease. It's not.
It's infection.
Yeah, unless you're using, fishing line or something, okay? It is a problem. So, no, and I think that what people don't understand is that you can have also the start of gum disease in just an area of your mouth, right? We see that a lot, kind of a localized area.
Definitely.
So, why don't you maybe talk about what do we do? If somebody does come to our office and we see signs of gum disease, and how do you, first of all, find that? What are you using to diagnose that? And then what are your options for treatment?
Well, I mean, first off, to diagnose it, we're just taking measurements. I mean, one of the big things we want to look at is where the bone levels are. The bone level holds your teeth in, the bone around your teeth holds them in. So if we start to see that you're losing bone around your teeth, that's obviously a big concern. Another indicator is bleeding, of course. Right. And so, I mean, just depending on the severity and your specific condition, sometimes it's as much as getting you using an electric toothbrush, flossing more, maybe more frequent visits. A lot of people, 2 times a year is not enough. Sometimes we have to do more every 3 months, every 4 months.
Well, that's kind of become the norm, Unfortunately, a lot of insurance companies, which goods and bads of insurance companies, but they tend to dictate how many times a year you get your teeth cleaned. Well, 2 times a year is not enough for a lot of people. In fact, most adults, they're finding more and more research, 3 times a year is much more appropriate for the majority of people mid-40s and older. And, if their insurance doesn't pay for it, they're like, oh, well, I must not need it. Your insurance company does not care about you, okay? Your doctors do. So please, if it's recommended to you that you need an extra cleaning in the year, I'm going to tell you, not only should you listen to your doctor, but make sure you do it, because if you don't and your gum disease gets out of control, Katie, what do you have to do? Or more importantly, what did they have to do in the past? I want you to kind of scare people a little bit about what happened in the past, and even to this day in a lot of offices they still do this. When you have bad gum disease, what are your treatments here?
Well, in the past, really the only option for treating gum disease was they would actually, and this is kind of gross, so sorry, but they would actually cut the gum tissue from one side of your mouth to the other so that they could clean the root surfaces, and then they would go ahead and sew the gum tissue back up.
Yeah. A complete surgery.
It was a surgery.
Yep.
And I mean, I guess one of the things that's really improved in dentistry now is we have lasers. And we're able to use lasers to clean underneath the gum tissue, to kill bacteria in areas that we couldn't get to before without actually removing gum tissue.
Right. And it's painless.
It's painless.
I mean, lasers, a lot of people hear lasers like they think burning. Well, when we're talking about cleaning gum tissue using a laser, it's on such a low level. All it's doing is sterilizing the area. And, people are afraid of the dentist. They think it all hurts. I'm going to tell you, the majority of dentistry does not hurt anymore. We've improved things drastically, especially the cleanings, whether it be dental work, anything like that. Katie, we have a couple of phone calls here. Why don't we take them, and we'll get back on topic here.
Sure.
We have Marjorie, who has a question about a wisdom tooth. Marjorie?
I do.
Marjorie, are you there?
I have a wisdom tooth that was filled when I was 16.
I don't know if Marjorie's
with a silver
there.
filling. I am 80 years old, and I had it all these years, but one side of the shell of the tooth broke away, and I've been told that at this age, if they attempt to pull it, there's a chance of the jaw breaking. How much risk is there of that happening?
Well, that's a good question. There's always risk involved in any type of extraction, and I guess you have to weigh the pros and the cons. If you have the potential for an infection in your body, I mean, that can become very, very serious at any age. But in our older patients, we got to weigh the pros and the cons. And I think that your surgeon could probably answer that question better than I can, because I'm not looking at the situation. But honestly, if you've got a broken tooth, it's not going to stay healthy for very long. And so you've got the potential for infection. And in a situation like this, I don't know how much choice you have. I feel like you have to take that chance. Most oral surgeons are just so equipped and prepared for things like this. And my recommendation would be have that out, because I've just seen so many problems with people who didn't. And you have these extreme infections of the bone that can be literally life-threatening. So, again, I'm sorry, go ahead.
I was offered the option of capping it, but it's broke right, the one side is broke down by the gum there, and there's no opposing tooth, really. And I just thought I would get it out, and then when I heard there's a risk of a break of the jaw, I didn't know which way to go.
Well, you know what, and that's a good point. I think that what I would recommend is have another conversation with your surgeon, because there's risks in anything, and we have these big consent forms that are there's a lot of scary things out there, but a lot of it is just informing our patients. And
Yes.
sure, is there a risk?
How
Yes,
often
but
it really does happen. Is it?
well, that's a good, and I'm going to tell you, not that often. And that's why, unless your situation is really, really, really special, my recommendation would be, again, to maybe ask some of these questions to your surgeon. But my gut says get the tooth out, and I think you're just going to be great.
Okay, appreciate the info.
Thank you for the call. And we have Sally with a chipped veneer. Sally?
Not really veneer. It's my actual tooth. It's like I have several teeth that the top layer would just break off, and leaving the tooth behind it all black. And about 4 years ago, I had MRSA, and I was wondering if, I know that it can get into the bloodstream and it can get into the bone, and teeth are bones. I was wondering if because this is something that I've seen on some forums before, some MRSA forums or whatever. Is this something that you've ever heard of, where bacteria that would attack your teeth would actually be MRSA bacteria, and that it would, attack the tooth in a way that, basically my teeth are just disintegrating. It's not decaying in like a normal way?
Well, I'll tell you, Sally, the first part of your statement there sounds like a severe grinding issue. Now, I don't know if you've ever been told that you grind your teeth at night or if you're a clencher, but that's very, very common when you're putting this abnormal stresses on your teeth at night. Things start to get very thin along the edges of your teeth, which makes them more brittle. Now, as far as the black and the MRSA, honestly, as far as I know, I don't know any research that I'm aware of, but not to say that it's not true, that is going to infiltrate the tooth. Personally, if I were you, if you haven't been evaluated by your dentist, I would highly recommend having them take a look. I'm not sure what area you're in, but that is a very, very, obviously that's a scary disease, but you have something happening with your mouth. It's very difficult for me to diagnose it over the phone, obviously, but I'm going to tell you, you are aware of the problem. I would highly recommend you have that evaluated because you want an answer. You want somebody to take a look at that and give you some concrete answers. Okay? But thank you very much for the call. I appreciate it. And if you do hear anything, please call back because I would actually love to hear what they found.
Okay. All right.
Thank you so much.
Thank you. Bye.
Have a great night. All right, Katie.
Yes.
Where were we? Lasers.
Lasers.
All right, and I know, we joke about, and if you can't, talk in an Austin Powers voice or anything. I think that what people realize about lasers and some of these newer things is they are better, but maybe they're fearful of this technology a little bit. I want people to know, and not only the results that we're getting, because the patients that you are seeing that used to have surgery, you're taking care of their gum issues conservatively, quicker, painlessly. It's all good stuff.
Well, one thing I have to say is, so gum disease, periodontal disease is treatable, but it's not curable. And so it's something that we can get under control and we can maintain and manage. But for patients who are managing it and then all of a sudden disappear from the dental office for a few years and come back and things have flared back up, we're looking at retreating and starting back at square one. Well, our square one is a little different than what most people have experienced in the past. And so after treating a lot of those patients, I can tell you that most patients are extremely happy to be experiencing the laser. The appointments are more comfortable. The results are better. So a huge improvement.
Well, what about when patients talk to you? Because I've heard them talk to you about how, they're thanking you for their healthy mouth. When your mouth is healthy after it's been unhealthy for so long. Not only do you see the results, but you feel it.
Yeah.
It's just such a cool thing. And
it's rewarding.
It is.
Yeah.
It's very rewarding.
Yeah.
And for those of you, honestly, who maybe have been away, like Katie said, I think that's a great point. Your mouth is not self-maintaining. And I don't care if you're the brushing and flossing king or queen out there. You can't get below the gums. And we've stressed this on other shows, Katie. I know that you believe this too because it's a fact. We can't go through life without professional cleanings.
Mm-hmm.
We can't. You also can't go years without these professional cleanings and just think everything's going to be normal. So if somebody was going to come to our office, I know, we've talked about how thorough you guys are, the oral cancer screening, everything. I mean, your evaluation, your first cleaning appointment, tell them a little bit about what they can expect, and maybe after that, if they do have a situation, maybe talk about our appointments, how we work them.
Well, at the first appointment, we always do a cleaning. We'll do the, above the gum tissue, normal, healthy, everything's great cleaning. If at that point we're identifying disease, then we'll do usually 1 to 2 additional cleanings using the laser.
Mm-hmm.
We also use the ultrasonic for all patients, and I don't think we touched on that.
No, and explain that a little bit.
The ultrasonic is a really interesting instrument. It's great. It uses basically sound and water to clean the teeth.
Mm-hmm.
So before where, the cleanings were the traditional scraping and cutting and,
the scary stuff.
Everybody hated them.
Yeah.
So now basically it's a power washer for teeth.
Love it.
Yep. It's comfortable. It's quick. Patients love it. So we do that at every appointment, but then when we're identifying the disease, we're having patients come back for an additional cleaning or two, really focusing under the gum tissue, sterilizing all that bacteria, getting things healthy again, and then keeping them on a schedule that works to maintain health.
Perfect. And that's really the key. We want you to come back. We want to keep you there. We want to keep you at this level of health that you can maintain at home. I'm going to leave people with this last scary stat, which is people with gum disease are twice as likely to die from heart disease and 3 times as likely to die from a stroke. This isn't just about your mouth here, people. This is about the rest of your body. And so, if you haven't been to the dentist in a while, get to one. If you're in our area, we'd be happy to take care of you. I mean, Katie's great. We have 2 other hygienists at our office, Val and Beth. They're amazing people. If you have any questions, you can call our office at 248-656-2020. Or again, please go to our website, rochesteradvanceddentistry.com. And everybody knows about our radio website, which is simpletruthsforhealthyliving.com. All the shows are there, archived shows. We'd love for you to visit and give us some comments. So, Katie, thank you for coming tonight. I appreciate it. I know that
it was a lot of fun.
I know
Thank you.
that I kind of pressured you into it, but I'm so proud of you. You did a great job, and I think we educated a lot of people tonight. So, I will be back next Wednesday. Dr. Joe will be here tomorrow night, and everybody have a great night. Thank you very much.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.